Hello, welcome back to another episode of What's Up Doc. Today we are discussing holistic dentistry. And I think it's time for me to address holistic dentistry because I've been transferring patients from holistic dentists into our practices. And when they call, they will ask for me specifically because I had most experience. I'm the senior dentist basically, to sit down with me and talk about, what is my approach, what do I believe is right, or what makes sense. Do I believe in holistic dentistry? Am I conservative, aggressive? Am I like elective dentistry? All this stuff. They just want to know my style. And from there on, they would commit to whatever their mouth need. So let me just say, first of all, the way I practice, I'm very conservative in a sense that if a patient comes to me, which I had that in the past, patient will come over and they will say, take everything out and I want denture. I'm like, all right, time out. We're not going to take everything out. Especially after clinical evaluation and finding out that I can save as many teeth as possible. So I have those requests, and I have other requests that patient want veneers just because they don't like their smile. And, do I tell them it's an overkill? Yes, I do. Do I try to convince them that, cutting the teeth and straightening them out or changing the shape of veneers might cause sensitivity or they're not a good candidate? Of course I do. So also, as my career has taken off, especially the past 10 years, it's becoming more functional dentistry. And it's really hard to explain because I don't think there's anything like it, and this is all in my head. The way I approach conditions and the way I approach treatment is from a functional, medicine point of view. Maybe because I've been under a naturopath functioning medical care, my PCP, and I learned so much about how the body heals, and I learned so much about trusting the body and believing that the body can heal certain things. But there's no reason for us not to combine our care with conventional medicine and functional medicine and Chinese medicine and meditation. Why don't you just do it all? I don't understand why we are discriminating or not towards one profession or the other. I think it's time for us to include all the knowledge that we have and all the science that we have and all the wisdom of body healing that we have and we are discovering, combine it all together into a field or an approach or a practice. And that's what I call the functional dentistry. Okay. So without further ado, I just want to read some of the definitions of holistic dentistry on a website called Healthline. And let's see what I think of that, okay? Again, here are my glasses. You're gonna get there. Sooner or later, you'll be one of me, all right? So I just went online, and what I did is I typed holistic dentistry definition. What to know about holistic dentistry. That's what the article is called. So holistic dentistry is a form of dental medicine. It's also known as alternative dentistry, natural dentistry, unconventional dentistry, biocompatible dentistry, progressive dentistry, integrative dentistry. And you see those also labeling of also in the medical field too. It's a type of dentistry approaches oral care from a holistic perspective. A little bit vague. Okay, holistic, it's a very wide term that can include a lot of things. It considers how oral health affects the whole body and vice versa. So that's a very good statement, but also it's unfair statement to limit it to holistic dentistry. I'm sure that a lot of dentists out there many dentists out there, they would look at the infection or the tooth infection as why it's happening. And let's take a look at the whole body and what's going on in the body, whether the body's going through stress, whether the body going through a lot of detoxification of medications that you're taking, side effect from medications that you're taking, post-surgery, pre-surgery. A lot of we do review medical history and update medical history every time the patient come in. It is a standard of care. So for them to say, or for the article to say that it deals with the whole body and make it sound like the conventional dental approach does not, that's not a fair statement. We are all trained to review the medical history and make sure that, and the reason why we review medical history, because drug interaction, drug side effects, medication, long-term use of medication, and we connect that to what we see in the mouth. So that's a little bit of unfair to limit it to holistic dentistry. It is all dentistry and all medical fields do review medical history and trying to, connect what's going on with the whole body with, at least in the mouth in my field. Philosophies, the primary difference is the philosophies behind each practice. Traditional dentistry solely focus on dental health. And that's, again, another unfair statement. Traditional dentistry does not only focus, and I don't know what traditional dentistry means. I don't think there's such a thing as traditional dentistry anymore. With all the advances that we have in dental material and the technology and the imaging, there's no such thing as traditional dentistry. The R&D of the dental materials, there is a new material getting advanced and discovered every single day. I know that because I have colleagues that works with dental materials in the university, in dental schools. Has nothing to do with pharma, has nothing to do with brand name. They are doing the research and research development as a collaboration from the dental schools and the dental material to make things better and more effective and help the tooth heal and get repaired faster and faster. The technology is amazing. So for them to say that, I believe, my opinion, is a very unfair statement. Solely focuses on dental health. Yes, we are dentists. We are specialized in the health of the tooth and everything else that connects to the tooth and everything else that surrounds the tooth. So for them to say dental health, it is true. It's nothing wrong with that. It's not a bad thing. This consists of diagnosing and treating problems that affect the teeth, the gums, jaws, area of the head and neck when affected by the mouth. So traditional dentistry, they say, solely focus on dental health, which consists of teeth, gums, jaw, and area of head and neck. Yes, we are specialized in the head and neck, and we're specialized in the oral cavity, and that's what we do. Now, that's what we go to school for. We are doctors of dental medicine or doctors of dental surgeries because we specialize in the organ that we call a tooth. But it's not limited to that. That's not fair, again, to put it out there and exclude all the dentists that really cares about the patient as a whole, how they're feeling. I mean, I talked about fear and anxiety in some of my videos. We deal with fear and anxiety as patients much more than MDs do. And because we have to go beyond the fear and anxiety level for us to reach out to the tooth and get to the tooth and fix the tooth or fix the infection or fix the pain or relieve the pain and figure out what's going on. So fear and anxiety is one of the primary things that we deal with, and we are trained on how to manage fear and anxiety. And I'll tell you, over the years, I had a patient last week comes in, and she had jaw pain and headaches. She saw 4 neurologists, and you know what they told her? Those are MDs. They said, suck it up. They didn't give her any option except wearing a night guard. So I talked to her about cortisol. I talked to her about anxiety. I talked to her about stress. I talked to her about Botox injection in the jaw because she can't function with all these headaches. The migraines were really, really bad, and she keeps taking medications. So don't tell me that we don't care about all of that. And she came in for like to see the crown, and we start talking about TMJ and TMD and muscle and joints, and and then we narrow it down to how much stress level that she had. And she was so thankful, and she was so pleased, and she was so happy. She started crying because she said everybody basically made it sound like I'm crazy and I have to just suck it up and live with it. And she was young. She's like 35 years old. So don't say that we don't care and we only focus on the tooth. So I'm out of time. I know this is going to be many, many videos to come. I'm going to keep addressing it in order to bring the two worlds together. And I don't want the division. I don't want for us to be divided and to be limited to a certain things than the other. I think the future is telling us, and the world is pushing us towards including everything that the patient come in with, whether it's, like I said, stress, anxiety, medical conditions. And that's, in my experience, that's how I practice, and that's how my team approaches things too. We never, ever exclude any medical, physical, mental, emotional condition that the patient's coming in with. So I hope that helps, and thank you so much for watching, and I'll be back with, I'm sure, with more videos, because my life every day is just patient asking the same questions over and over again. And have a great weekend, and I'll catch you in the next video.